everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing folks that are not only in private practice, community health, rural health, FQHCs, and we are so excited to bring new people to you every week. We have new people in different specialties. We have folks that, are here to provide us new perspectives and things to sink our teeth into every week. So I'm very excited to introduce a very special guest. Dr. Singh. He is the medical director of Samaritan House in San Mateo County. Welcome, Dr. Singh. It's great to have you today.
Rachel, it's an honor to be here today.
We're excited. I know that we have a lot to dive into, and I know that we have a lot to get to. So I'd love if we can even just start out a little bit, getting to know you. I'd love to hear a bit about your background, and also I would love to learn a little bit more about your role at Samaritan House.
So thank you again for the opportunity. It's a pleasure to be here today. So I started my career, I did my residency at UCLA in LA.
Mhm.
And right after that, I was very keen on trying to explore the serving in the underserved community.
Mhm.
So I joined the National Health Service and worked in a federally qualified health center in uh, Northeast Los Angeles called Northeast Valley.
Mhm.
And these are patients that are on Medicaid or Medi-Cal in California. And I did that for 3 years and then came back and did my about 14 years on faculty at UCLA. And then I moved to Stanford, where I've been here for 16 years. I was the medical director for internal medicine for 13 of those years. And then the last 3 years, I was really keen to get back to my passion of helping the underserved. And through some support from Stanford, I am now the medical director of Samaritan House.
That's amazing. It seems like you've had a great deal of experience and also a wonderful passion for helping, not only underserved communities, but your community in general, through everywhere you have moved. So that is wonderful to hear. And I would love to hear a little bit about also, tell us a little bit more about the population that you're serving, at Samaritan House and what are maybe some of the services that you offer within the clinic, but also beyond as well.
So, Samaritan House, I would say, is unique in that there's a term we use called social determinants of health, which means that not only are we taking care of the patient, but also the surrounding parts of the patient's life that affect them so greatly. Work, housing, food, insecurity, financial assistance. So, Samaritan House has been dedicated for 50 years to supporting the working poor in San Mateo County.
Mhm.
Um, they provide care and support for over 32,000 patients in the county, so a huge footprint.
Huge.
And these are people that are our working poor in our community. These are people that are our gardeners and our teachers and our nurses and support all of the people in the county. And through a variety of reasons, they're not able to either meet their payments for Medi-Cal or are ineligible for Medi-Cal and therefore need our medical services. We also provide dental services, mental health services, and for our diabetics, we have a food pharmacy.
You have quite the umbrella of different services that you offer your community. That's incredible. It's very hard to find folks that do as much as you do. And that's really incredible. As the medical director, you have, a bird's eye view in terms of what's happening. I'd love to hear a little bit about, I think there's things that don't always meet the eye. I mean, you've already shared so much in terms of what you guys do outside of, the medical capacity as well, but I'd love to hear, what you're caring most often for, what you like in the clinic, but then also there might be some unique cases that maybe don't come by your desk as often, but you take care of them and maybe not everyone is aware of those things. So I'd love to hear the range of things that you see within the clinic and what you're most most often caring for, but then also maybe there's some unique cases that you can share with us.
So, for a variety of reasons, most children are covered by Medicaid. So the population that's least covered are people from 18 to 65, although we take care of everybody 18 and older. So
Mm-hmm.
we're primarily taking care of an adult population that doesn't get access to care very often. So unfortunately, they present to us with later disease. So often we will get patients sent to us from emergency rooms and hospitals after an event, a heart attack, a stroke, a presentation of diabetes. So in our patient population, which is almost 90% plus Latino, we have a huge population of diabetics, very high incidence of diabetes in this patient population. So all of the things that are related to diabetes, we say, um, and so caring for our patient population to keep their sugar under control, blood pressure under control. So primarily good primary care services. We're fortunate that we have over 50 volunteers, so we're able to also provide extensive secondary care. That means dermatology and ophthalmology and cardiology. So part of our challenge is because patients can't access medical care through the county system, given particular limitations or what we call share of cost, that they have to pay a certain amount to get in the system. Um, we're trying to provide as much services within the clinic as possible. So we're very proud that we are able to try to really not only take care of those primary care services, but also expand to secondary care services.
That's amazing. It's again, you're doing so much under one umbrella. And you also mentioned that you have volunteers that work with you as well. What's that been like? It's wonderful that there's so many people that are willing to volunteer their time and be in a clinical setting. Can you share a little bit about your volunteers that help you guys out so much?
Yeah, so what I'm most excited about and proud about is the volunteers that come and volunteer in the clinic. So we have over 50 volunteers. These are often either providers who have a little extra time and they want to give back to their community. But I would say more than half of our volunteers are retirees who hear about the need in the clinics and in the county and want to give back. And so seeing providers come back to see us after they've retired, taking out time out of their week to give back is very heartwarming and very inspiring. And they're really motivated to help our patients. And that generosity, I think, is expressed through their care for the patients. But also, I think what's nice is our patient population is um, very grateful for the care that they get, knowing that it's free. And I think it ends up being a two-way street that um, gratitude invigorates the volunteer staff to continue to give back.
I always think that there is a why behind everything that you do. And, it is really heartwarming to hear that so many people have get dedicated their time, whether it's why they're still working or after they've retired, to come and do this and serve a population that they really care about their own community. And so that already makes Samaritan House unique in its own way. But I'd love to hear about how your approach is really different. And if you have anything else to share in terms of what makes Samaritan House unique, I would love to hear it. You've shared so many golden nuggets already, but I'm sure there's so much to learn, and more behind closed doors.
So I think as an organization, Samaritan House is really unique in that it's an incredibly well-run nonprofit that serves a huge swath of the county and really is dedicated to providing services in every corner of the lives of the working poor. And that part was really what brought me to want to be part of this organization. As far as what makes the clinics and our approach unique, I think we are trying to take a holistic approach. That's why we have strong mental health services. There's a huge amount of emotional trauma and anxiety, depression in this patient population, as you might expect.
Sure.
We have dental care, because almost everybody that walks through our door needs dental care. And we've tried to help our diabetic population through the food pharmacy. The food pharmacy was the first food pharmacy in the state of California. And so this is again a holistic approach where we're using food as medicine to try to not only give patients medicine, but also educate them on the correct types of food and nutritional education that they need in order to really take care of their disease.
Absolutely. And I love if you could just double click into the food pharmacy because you don't often hear that. And you don't often, and I don't think a lot of people would know what that is. So if maybe you could share a little bit more about whether it's certain types of food that is offered and what can people do and take. I'd love to hear more about your very interesting food pharmacy.
Yeah, so it is unique. There's no doubt. So we have a very passionate food pharmacy director, and basically we run diabetic classes and nutrition and dietitian support for the clinic.
Mm-hmm.
But when we're telling patients that they need to eat healthier food, fruits, vegetables, stay away from carbohydrates,
Hmm.
as you know, when you go to the supermarket, these are very expensive foods for most people to purchase. So by providing free, healthy proteins, fruits and vegetables, um, uh, healthy oils, the patients then become indoctrinated into, they come to the clinic every Wednesday, pick up the food that they need, understanding that these foods are healthier, better foods for them. They learn in the process. They're not wondering whether they can pay for the food because it's free to them. And as a result, we actually can see their sugars start to drop uh, as a result of just the nutritional input that they're getting through the food pharmacy and the healthier food they're getting.
That's amazing. It does create, if you are seeing a physician and they're telling you that you have to, change your diet a little bit to, to be healthier at the end of the day and move your, health trajectory in a more positive direction. And you go into this bad feedback loop when you can't afford, and because the groceries have gone up, so much all across the United States. But when you can't afford that and it's harder, that much of a barrier to implement, when it's already hard to change your diet, it's so great that you can invest time in not only educating your patients, sharing the right foods with them, and then ultimately seeing them get healthier day by day. So I think that it's such a positive loop that you're able to provide to folks that it just makes that barrier to change so much easier for them.
So we're committed to try to lower the barriers for people. And so this is why we've taken this multi-prong approach, for which the food pharmacy is one important part of that uh, um, total holistic approach to our patient care.
Absolutely. And, as the medical director, and through all of your experience in healthcare, you have seen you had a front row seat to how it has evolved over time. And it keeps evolving and it keeps evolving. I would love, because it's relevant to your population, I'd love if you can share a little bit about, what is happening with Medi-Cal and how that affects the people that you serve, and what ultimately do you wish patients, knew about it or other people knew about it as well?
This is a really important point that you're bringing up and that we really wanted to highlight. Um, the new Medi-Cal laws are such that the cost of Medicaid is going to go up for patients. So a huge population, just in our county alone, 150,000 people are on Medi-Cal right now. And
Mhm.
we're expecting with the changes in cost that 30 to 60,000 people may lose their Medi-Cal just in our county alone. So we're a small clinic. We see about 2 to 3 thousand patients a year, almost 12,000 patient visits to take care of those patients. We're gearing up a little bit, but our big message to our patients is understand what's going on with your Medi-Cal and don't lose your Medi-Cal. So the first point is that if they're aggressive, they're proactive, go online, find out when their expiration date is so they can re-register ahead of time so they don't lose their Medi-Cal and
Mhm.
then scramble to try to get it. They may not be eligible if they lose it. So we are engaged in coordinating with our county in a mass campaign to try to improve education around Medicaid and Medi-Cal, um, such that where patients will proactively go and try to keep their Medi-Cal. And that's done through flyers and social media and coordination with the San Mateo County system.
Yeah, it's really difficult, health insurance, or any type of assistance, between the application alone and what you get, and it can be really confusing at times. And then when you don't hear about a change like this, and you do let something lapse or expire, it can be really devastating. So it's so great that you are working with your community as much as possible to ensure that they get the proper care that they need, and that just further supports everything that you're doing at Samaritan House. Really, it's really patient centric and really patient first, and that's wonderful. Um, I'd love to, kind of wrap up today with something that I like to do called pro tips. And I think you've given us so much to think about already, but I'd love if you could share some amazing pro tips. You've given us so much to think about already, but maybe there's some ideas that, you give for, typical homework for a patient or a client. And, what are something we can all do today to move our health forward? Whether it's potential screenings or medical appointments to not miss out on. I would just love if you can share with us some of your pro tips from the medical director, the pro, and that would be really fabulous. We'd love to hear it.
I'll just give you a few. Because I teach residents at Stanford, we go through the literature and look at what are the most cost-effective strategies for health.
Mm,
And one of the ones that came out recently that it just I'm always struck by is the power of exercise. So if you exercise regularly, you have a 30% reduction in cardiovascular disease. So people may be familiar with cholesterol medicines called statins. If you take statins, you only have a 10% reduction. It's an important medication, but exercise is 3 times as powerful as a cholesterol medication. So exercise is one of the things that we really try to push because it's free and its value in cardiovascular health, not to mention mental health,
mhm.
sleep, um, balance, et cetera, et cetera, et cetera. It basically is really the one of the most important things I always try to emphasize. The second is a little more obvious, which is quit smoking. Probably the biggest bang for your buck as far as 25% reduction in cardiovascular risk in the first year. So if people were just to exercise and quit smoking, would make a huge difference when it comes to their life expectancy and quality of life. The third thing I would say is make small changes. Don't try to boil the ocean, but try each year to make a few small changes in your health, eating better, cutting out bad foods, reduction in excessive alcohol, increasing exercise, make small but persistent changes. And finally, I would say, get regular checkups. We pick up a lot of things. We have cancer screenings that we do. We do vaccinations. We screen for cardiovascular disease and other health issues. And in that process, you can get a holistic 360 view of where you are with your health. And that I think will help direct people towards better um, decisions in moving forward with their health in the future.
Absolutely. You can learn a lot by the data. And if you have the data about your health, you can see how you're doing over time. And it's so great that you're able to provide not only all those screenings, but cancer screenings too, and how much that is also, on the rise with the younger population as well. And so that's really important as well. And in terms of maybe just one more pro tip, I'd love to learn from you out of the providers that are also watching this, just as important for them. Is there anything that you can, recommend that you'd love them to know about your area or how they can help?
Um, if you're saying our area in underserved care, I would say a couple of things. Number one is, look around your community and see where you can give back.
Hmm.
A lot of our providers come to us through exploration of their community, understanding that, okay, I may not be able to go and volunteer, but maybe I can donate a colonoscopy or I can donate a stress test. So a lot of our community is also donating through an extended network of services that they provide to us. Um, and I would say trying to think about not only the health of your patient population, but the health of your community through
Hmm.
seeing what is the health of my community and where are some of the areas that I, as a provider, we are very unique and blessed in our profession to have um, to be able to give back. And I think making sure that not only you're providing for your practice, but also for your community, I think is a message I would love to send to uh, all the providers listening.
I couldn't agree more and couldn't agree with a better way to end our wonderful time here with you, Dr. Singh. We really appreciate all that you have shared with us today. But one more thing before we leave off, I'd love if you could share where folks can reach out, where they can find you, and all the shout outs that you would like to give at the time.
So I wrote it down just because I won't screw it up. It's we're at Samaritan House, San Mateo, all one word, Samaritan, like Good Samaritan House,
Mhm.
sanmateo.org. And we're also on Facebook, Instagram, and LinkedIn. So please look out for us. We'd love people to think about supporting us and getting involved. It may not even be in the medical area. As I mentioned, we gave 5 million meals last year, so we do a lot of food services, financial assistance, um, support for all working families, and there's many ways to give back.
Thank you so much, Dr. Singh. We appreciate you and everything that you're doing at Samaritan House and for your community. And today was amazing. We've learned so much from you, and we hope to have you on again soon.
So much, Rachel. I really appreciate it.
Thank you.